My name is Avery, and today I'll be discussing the different branches of nursing and the processes that it takes to pursue a job in the nursing field. More and more young men and women aspire to be nurses every single day. All of you probably know someone that is in nursing school or aspires to be a nurse. According to AmericanNurseToday.com, there's been a significant rise in nurses since 2000, but many hospitals still have a major shortage. It is a difficult process to pursue a job in the nursing field and requires a lot of school and training. To get a CNA certification, it can be around a year or so, but for nurse practitioners, it can be 6 years or more. Many people do not know the entire process of pursuing a job in the nursing field, and it is a very essential job. There are thousands of branches that provide millions of jobs all over the world. Let's begin with the school and training required. The CNA path the course is provided at community colleges and vocational schools. It requires around 75 hours of classroom training and 16 hours of clinical training. The next is the RN ASN path, or Registered Nurse Associates of Science in Nursing path. It requires a 2-year college program to obtain your ASN and then pass an NCLEX exam, or National Council Licensure exam. This program is available at many community colleges. The RN BSN path requires 2 or so years of prerequisites, and different schools require different prerequisites depending on the size and state that you attend school in. It requires 2 years of nursing school after your prerequisites, and then you obtain your BSN, and you must pass an NCLEX exam. For a nurse practitioner, you attend 4 years of college majoring in only nursing, and then you obtain your BSN. After that, you obtain at least 2 years of RN experience as the specialty of nurse practitioner that you would like to be. For example, a neonatal nurse practitioner would be an RN as in a neonatal ward in a level 3 NICU. After that, you must go back to school and obtain your MSN, or Master's of Science in Nursing, and pass a nurse practitioner certification test. Let's break down all of these jobs. A certified nurse's assistant, or CNA, is the fastest way to start a job in the nursing field. You work under the supervision of a nurse, and you provide basic care for patients to live functionally. A lot of their job has to do with the comfort of the patients in the hospitals or clinics. They can work in hospitals, clinics, and many other places. The RN ASN does many of the same jobs as BSNs, but they only work in smaller hospitals and clinics. The RN BSN is very similar to ASNs, but they have more training and more schooling. They work in large hospitals and clinics. Another job that I want to talk about is a nurse shift manager. They preside over all of the nurses in the hospital and make sure they're getting their rounds done and working functionally to take care of their patients. In small hospitals, that requires a BSN, but in some bigger hospitals, you may need an MSN and a management degree. Nurse practitioners are very similar to doctors, but they cannot treat seriously ill patients. They can prescribe minor medications and diagnose illnesses. They work under the supervision of a doctor or can have their own private practice and create their own hours. Many of the doctors that we see at our minor emergency clinics are nurse practitioners, whether we know it or not. The next time that you see someone that is attending nursing school, make sure you tell them how great of a job they're doing. We need more and more people to take care of our children, our grandchildren, and ourselves. The local nurses that you know in your clinics and your hospitals worked hard to pursue their career and to get their certification so that they could take care of you. They did this because they love their jobs. The demand for nursing is very high right now, and we need a lot of people to take care of us, our grandchildren, and our children.
That was 4.5 minutes. That's good.
So we were pretty close. We're just a few seconds off. I had mine counting up. You had yours counting down.